As more people continue going back to pre-pandemic activities, a new report is illustrating just how devastating the virus has been for pregnant women. Fox's Gary Baumgarten has the latest data on the surge in maternal mortality rates.
A new report from the U.S. Government Accountability Office reveals COVID-19 was responsible for a severe increase in the number of women who died from pregnancy or childbirth complications last year. According to the data, COVID-19 was a factor in a quarter of the nearly 1,200 pregnancy-related deaths in 2021. This comes as officials say pregnancy-related deaths have soared by roughly 80% since 2018, with the pandemic only making things worse. The U.S. is one of the only industrialized nations in the world to experience rising rates of maternal mortality. The report cites the largest jump in deaths occurred between July and December of last year, back when the Delta variant was prevalent. Officials say pregnant COVID-19 victims faced higher health risks, adding staffing shortages at hospitals and pandemic restrictions prevented some expecting mothers from receiving critical in-person care. Pregnant women in minority and low-income communities faced elevated struggles and risks, with the CDC reporting Black women are 3 times more likely to die from pregnancy than white women. Meanwhile, preventing infant mortality also remains a large concern.
Our goals are to create systems that prevent marginalized women from experiencing social conditions that can lead to medical problems that then result in poor birth outcomes.